first I would like to ask you permission to see this video for educational purpose and on internet.
Yes.
Now, tell me about your symptoms before the surgery first.
So before the surgery, I couldn't even walk. I couldn't sleep because the pain that radiated down the left leg was so bad.
Okay. How long did you have that pain?
That lasted from March 23rd until you did the surgery.
Okay. And the pain was as well in the leg?
Oh, it went all the way down my leg.
Okay.
All the way
or...
down. Nope, just the left leg.
Okay.
But it was like constantly being stabbed.
Okay. Now, the surgery was barely a month ago, right?
Yep, the surgery was exactly a month and 2 days ago.
Okay. Well, how long did you stay in the hospital?
Overnight.
Over the night. And this is what we did. We did a 2-level olive procedure, 2 spacers, 6 screws, and this, by any regard, is a big surgery. But my surgery took actually about 55 minutes.
Yep.
We lost about an ounce and half blood. So, and you stayed only 1 night in the hospital, right?
Yep, I stayed just the one night and I left. I was gone by noon the next day.
Yeah.
Because I was up and walking, everything was great.
Yeah. When did the leg pain go away?
It was gone when I woke up after surgery.
Yeah, you just woke up and the leg pain was gone.
I woke up literally, yes.
Yeah, yeah. And how long after the surgery did you walk?
So we got done with surgery, around 2 o'clock?
Yeah, and early
I
afternoon.
was walking at 5.
Okay. So
within 3 hours of surgery, I was up and walking.
So how do you feel now?
I'm ready to continue. It's time to get my muscles back and get things going again.
So you feel good?
No, I feel great. The
Excellent.
pain is gone. You can't expect, I honestly didn't think it would be this quick.
Yeah, okay. Well, now, may I ask as well, your observation about her? So tell me, first of all, what do you notice that is different with her?
I've noticed her energy level has increased, her pain level has decreased. She's more active with the grandkids right now.
Excellent.
She's doing great.
So she's a more useful grandmother now, huh?
She's not broken.
Yeah, because I've been climbing up into our pool.
Yeah.
So I have to go up the 5 steps. And then I just turn around, and the only thing I do is I just keep making sure that I'm not twisting.
Yeah.
And I don't have to do any twisting, but once I get into the pool, Grandma's on the roll.
What were you expecting before the surgery? For the surgery to be?
I wasn't sure, honestly, how long the recovery was going to be. That was my biggest fear after the fact, was, am I going to be able to, because I was walking 1.5 miles up until I fell on March 23rd.
Yeah, until it happened.
And, yep. And then after that, I was like, I just wasn't sure. Pain.
Did you talk to anybody about your back problem, back surgery before the surgery?
I've gone to a couple different orthopedic surgeons.
Okay, well, no names.
And no names. And they told me until I lost control of my bowel or bladder that they wouldn't fix me.
Okay.
They didn't care what the pain was. I sat in their office crying. I was in so much pain.
So, and I think the idea was that there's a problem, it's not bad enough. But first of all, orthopedic surgeon, when they do only spine, they're as good as neurosurgeon. But I think the idea was that the surgery was such a big surgery that unless the symptoms are much more severe, the risk versus benefit is not justified. Whereas our surgery is so much less riskier, 55-minute surgery, 1.5 ounce blood loss.
Right.
And I think the pain is a very good reason for this surgery, and you're a proof. You weren't making it up.
Yeah, no, I'm not. To go from sobbing to being in so much pain, doctors were just like, go to the emergency room. There's nothing they can do until you took that pressure off my spinal cord.
What do you want those surgeons to know after what you went through? What do you want them to know?
Send them to you. No. They can't. You have to take the human into consideration.
Yeah.
I mean, they weren't looking at me as a person. They didn't care what my symptoms were. And they saw the same thing you saw in the CTs and the MRIs.
Yeah, I want to give them credit to really see you as a person and treat you as a person. But one of the things we learn as surgeons is weighing risk versus benefit.
Yep.
The damage
and I'm glad they didn't do the surgery.
Yeah. Okay.
Because I don't have that 6 to 8 inch incision.
Yeah.
I have just the multiple little incisions that were healed in 2 weeks. All the bandages were off. And I'm ready to go.
Well, I'm happy you found me.
I'm happy I found you.
I'm happy you found them.
Yeah.
Well, and I hope your children are happy.
Oh, yeah.
She found me.
Yep, 'cause
Because
it was
now
rough.
she can spend time with them.
Yep, her middle daughter came up to help. She was up 3 days after surgery to
Okay.
help me.
Okay.
Because she knew Nana couldn't bend, twist, or lift, so she did everything.
Excellent. Now, well, it's time to get better now. Okay.
Yep,
Well,
time to get the muscle back.
Thank you very much. I appreciate that.